Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us.
Yes. Welcome back to another episode, Keeping Ashland Healthy, with Dr. Ashley Ackerman and David Ross.
The boss.
Well, thank you. I appreciate that, Dr. Ashley. We just welcome audience into another episode. This is something for those of you that might be new. Mental Health and Recovery Board is really interested in providing information about substance use, mental health issues, what the board does, the important work we do with our contract providers, Appleseed, Acada, and Catholic Charities in the community. But we don't limit ourselves to just the things that the board funds, but we talk about current issues, things that are pending, things that affect us in Ashland County, but also in the state and even nationally sometimes with some of our topics. So this is something we believe strongly in. Community education and awareness is a critical part of what mental health and recovery boards do. It's a part of our mission and vision. So we appreciate you all listening. And if you've not liked some of our episodes on YouTube. We've got a whole bunch of them on YouTube. We've got about 80 or so of these things recorded that folks can get whatever your favorite platform is, whether it's mine is Spotify, Dr. Ashley, but you know, it could be you have those Apple devices.
Apple Podcasts.
Is that what those are? Apple. You can get it wherever you want. iHeart is a partner of ours. They've helped us with standing up our podcast over the years. So I know you can stream these via iHeart as well.
Yeah, and let us know if you have a topic that you're interested in for a future podcast.
Yes, yeah. And they can just do that, 419-281-3139. You can just call in and just let us know, hey, you guys should talk about this. Or, you know, there's somebody that you should talk to, like an author or somebody in the community. We're open to stalking people and see if we can't convince them to come on the podcast, either in the studio here. We have a modest, but we think decent studio, or we can always Zoom somebody in if they'd prefer that. So today, Dr. Ashley, we've got a few articles. We are just about a week out from our big RSVP conference over at AU in the Convocation Center, our 16th annual.
So exciting. Yes.
Man.
One week away.
That's almost as old as you are. Can you believe that?
Not quite.
Oh.
Not quite.
This conference we have been doing for a long time. We have got another fabulous lineup, and one of the agenda topics for today will be the last of our speakers. We tried to highlight all of our speakers before the conference, so we're down to our last speaker that we wanted to kind of highlight, promote, and discuss. We'll get to that, but before that, Dr. Ashley, we've got some articles that I think people will find interesting. We're always trying to be cutting edge on the Keeping Ashland Healthy podcast. So let's kick it off with an article that was written for Mad in America a week or so ago, and this was an interview, and it was called "Dad, Something's Not Right." Richard Fee on the dangers of Adderall. Now, what a lot of folks probably don't know is Richard passed away from. He died by suicide, but he had some complications due to his Adderall prescription. And his father and mother have really started a foundation, the Richard Fee Foundation, in honor of him, but also to, again, try to make sense of his death and that loss, and try to manage some of the emotions they've experienced, from anger to just some, I think, sadness and grief over the loss of their son, who was relatively young.
I was wondering if he was younger.
Yeah, he was younger, and really had, like a lot of young people, had just starting his life, doing well in college, and just so many opportunities that he was just getting into, and a young life cut short, which is so always tragic. Yeah. So what was interesting, and again, for listeners, don't worry, we put all the hyperlinks in the information so you can listen to or read about these articles in full in the episode description after today's broadcast. But the father, Rick Fee, was interviewed by our very own keynote speaker, Brooke Seam. So Brooke does a fair amount of interviews on various broad podcast herself. So this Dad, Something's Not Right conversation is between Brooke and Rick, who again lost his son, Richard. And really, a lot of people don't know, but I think someone in our audience will know somebody that is on one or more psychiatric medications, and it's not always smooth sailing. And what I mean by that, Dr. Ashley, is it's not uncommon at all for us to all experience, effects of the psychiatric drugs that folks take, and some of those effects are significant and severe. And one of the things we're trying to raise awareness of is that we want to make sure that anybody who's prescribing or, taking, there's what we call informed consent, that there's a lot of information shared from the very beginning about the pros and cons of a given medication or the possibilities of interactive effects between one or more medications, and that folks really have as much information prior to starting, the medication, so they can make that good decision about, yes, I'm going to try this. And that involves understanding what some of those sometimes called side effects. Other people just call them drug effects, because all drugs have effects, whether it's my caffeine, if it's alcohol, we just had St. Patty's Day. If it's any type of substance, there's effects. And so folks...
And some of those can be pretty serious,
Yeah. Now, one of the things folks ask me about this, and I usually just direct folks to, if you watch any television, it's hard to get through an hour's worth of any kind of broadcast TV without at least one ad for psychiatric medications.
Yeah.
And again, I just ask folks to pay attention to how much time is spent on talking about the medication and its benefits, and then how much of the commercial is spent, usually in a very, 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 very rapid voice, explaining all the potential negative side effects. But my fear is, because it's so fast and there's so many things, I think there's a tendency to just tune that out.
I think so too.
Yeah.
Or there's in my family, I've heard jokes about it too.
Oh, okay.
Definitely don't want to take that medicine, because it's all these
it's
terrible
usually
things.
a rogue's gallery. It's like the worst possible symptoms ever.
Yeah.
And I think, I don't know. Yeah, I think there's different reactions. I've talked to so many different people, but more often, some people like you will say, well, why would I take that?
Yeah.
That sounds horrible. That sounds worse than what I'm struggling with.
Right.
Right. But then I think some other folks are so desperate that they just kind of tune that out.
Yeah, I think so too. And a lot of times, I don't know if you've ever been prescribed a medication by a doctor, but usually they'll hand you the packet of stuff with all of the warnings on it. Mm-hmm. But they don't always have a conversation about those things. I don't always read the thing, I'm guilty of that myself.
Sure.
So,
Yeah. So, I mean, this interview is powerful, but it's also, I want folks to understand too that Rick, is still grieving the loss of his son.
Sure,
It's not been that many, years since he's lost his son. So if you know somebody that's maybe lost a son or a daughter, a husband, wife, anybody to suicide, I just want folks to know that before they listen, that, it can be emotional to hear, about his passing, and but it might be helpful. My hope is, and I know the reason they did the interview was that they'd be helpful, because we do lose people even to suicide, and that suicide might involve at least some of the feelings that they're having because of the medications, or the flip side, and why we're having our conference this year at RSVP. If somebody has just recently stopped taking a prescribed medication, maybe they didn't talk to their doctor about how to titrate off or to taper off. They just did it on their own.
Yeah.
Or maybe they are doing it under the care of a physician, but the physician doesn't really know how to titrate off a given medication or one or more medications, because quite frankly, there's not been enough education in our view on that, and that's why that's going to be a topic that we're going to feature at this year's RSVP, about what we know, what we don't know about titrating off psychiatric meds.
Yeah, I think it's a really important topic.
Yeah.
And especially we're hearing a lot of people using Adderall now, a lot of young people.
Yes.
Especially. There's even a Netflix special about
I believe
Adderall
you're right.
use in college. It's
So
a big thing.
I thought this was timely because the article will get into it, but there's a ton of scripts being written for Adderall right now. And as you say, it's different age groups.
Yeah.
But it's very common. So, Dr. Ashley, bear with me. I just thought this quote was really important because this was Rick towards the end of the interview. Brooke basically asked him, what do you want people listening to this podcast, parents, to know, based on your experiences? And he said, quote, "For parents who are in the middle of this, whether it's Adderall or any other psychiatric drug, reach out to anybody that they think may help. It may be someone influential in the person's life who is going through this and might be able to get through to them, perhaps a close friend, mentor, or coach, anyone they believe could help. It could be another doctor, or it might not be. What matters is finding someone who can make headway." And what he's referencing there is sometimes even when folks are on these medications, they're still in distress, they're still struggling, and you don't want to limit them. You want them to get help. And if you can't do that, or you don't feel like you can connect with the person, find somebody who can. Find that, like he says, close friend, mentor, coach, anybody that they believe could be helpful to them. And then families just need to recognize this and reach out to whoever they can. Anyone is welcome to reach out to us at the foundation that they set up, and we will do everything in our power to connect them with the right people. And they've already done this countless times before, he says. So I think it was a hopeful podcast, a difficult subject matter. Obviously, whenever you're dealing with suicide and losing a son or a daughter, it's very emotional. But I'm recommending it to our audience that they might find a value, and it's not overly long.
Yeah, and an important message for sure. Yeah.
Well, our next piece, Dr. Ashley, is around exploding myths about schizophrenia, an interview with Courtney Harding. Now, Dr. Harding spoke at RSVP many years ago.
Cool.
I know.
Yeah.
She's a bit of a legend in the field of counseling, psychology, psychiatry. She was the principal investigator for the Vermont longitudinal study. Now, Dr. Ashley, this is why I don't get invited to parties, because I'm a nerd. I know what the Vermont longitudinal study is. I would say most of our audience would say, what is he talking about? So I get it. Yes, you probably have never heard of the Vermont longitudinal study, and I don't blame you for that.
That's why it's on the podcast.
That's right. Please don't judge me for knowing about this. But Dr. Hardy wrote up a paper based on her research, and it was very important and very influential because she was one of the very first voices back in the 70s and 80s to publish a paper that basically said individuals, again, this is so historic, Dr. Ashley, because she was writing about a time in the 50s and 60s where we talk about deinstitutionalization in the United States, when there were a lot of folks that were in the psychiatric hospital system in our country, and that after some acts were signed around the Kennedy administration, it was all about how can we move folks out of the state psychiatric systems into communities? How can we stand up community systems of care so that they can see folks in a community setting versus a psychiatric hospital setting, improve their quality of life, functioning, et cetera. Yeah. So she started to study the folks that left the hospital and moved into these communities. And particularly she wanted to focus in on folks with a schizophrenia diagnosis because, again, then, like today, that diagnosis is often seen as like the most severe.
Right.
I think her thinking was, how would these most complicated and severe individuals fare in the community? Is deinstitutionalization working, basically, is what she was trying to ascertain. And lo and behold, she found out some very important things. She noted big picture that the improvements that she observed, and it's called the longitudinal study because she studied the same group or cohort group over time, so multiple interviews. Yeah. So it wasn't just a one and done. So she would go back year after, her and her researchers would go back year after year and re-interview the same groups of folks to see what's changed. How are they doing? And some of the things I wanted to read to the audience that I thought were critical, and this isn't, obviously we'll link to the study. There was 168 people in the interview. 83% several times were not in the hospital. So most of them were living successfully out in the community. 66% moderately close to very close relationships. Again, that was contrary to the thinking at the time and to this day. The idea that folks with these severe diagnoses can be successful, not being in the hospital, living in the community, forming close or very close relationships.
Yeah, it said 102 people were either married, widowed, or divorced.
Yeah.
And that's, you're right. That's not something people think of with schizophrenia often.
76% of them were meeting with friends every week or two. So again, that connection was there. Social support was there. A lot of the folks were employed, 47%, which is, again, cuts against the grain.
Yes.
Folks with this diagnosis.
Maybe stereotypes about people with the diagnosis. Yeah.
72% displayed slight or no symptoms. Again, amazing. 79% were meeting their own needs. And 76% led moderate to very full lives. That's based on their report. And then one of the clinchers was, Dr. Ashley, well, how'd they do all this? And only 25% of them stayed on medications.
Yeah.
So 75% of them weren't even on medication. So again, you have to go back a little bit in times. In the 70s and 80s, that was like, what?
Yeah, because people thought, you need medication to be functioning as a person with schizophrenia.
Especially with this diagnosis.
Yeah.
You couldn't pause it. So for the audience, we try to stress in Ashland County that we're not a no medication county or board. We just want to think deeply about the use of medications, and we have a principle that we talk about a lot called medication optimization, which means, and this is all articulated in a document that it's available on our website, ashlandmhrb.org, our human community, which talks about just a real logical use of medications. Again, delayed starting them, use as few as possible, the lowest doses as possible for the shortest amount of time as possible, et cetera.
Yes.
And because what we find is there's an over-reliance. And even back then, we had evidence, even during deinstitutionalization, that folks, even that were considered the most severe, didn't necessarily need psychiatric drugs for the rest of their lives to be successful. And so Courtney's study, you might not be surprised, Dr. Ashley, was buried.
Right.
So it did not get the kind of attention or traction that it should have.
Why do you think that is?
Dr. Ashley, you're baiting me. You're tempting me to say things that'll get me in trouble.
No.
It was not the message that a lot of folks wanted to promote at the time. Particularly during the 80s and 90s, we really saw the advent of psychiatric medications and their popularity. And Prozac, when it hit in the commercials, et cetera, things were just off and running. So the idea that folks with these severe conditions didn't actually need psychiatric medications, or a large number of them wouldn't need that to be successful, wasn't a narrative that was embraced by a lot of folks.
I gotcha.
So, but the importance of the Vermont study is it did show that from the very get-go, I think what we all knew as counselors and social workers and other folks that help folks with these conditions, that they really were conditions of living, problems of severe emotional distress, but with enough supports that didn't necessarily include psychiatric medications, folks could live full, meaningful lives without it. It's a shame, but we moved away, but now we're moving back towards what we knew could work.
Oh, we talked a little bit on our last podcast about Pat Risser and Recovered. Remember that?
Yeah.
That's just another example of how people maybe don't sometimes expect people with severe mental health troubles to recover.
Yes.
But that this study really showed that is possible. People do and can recover.
Yeah, I think people like Pat point back to the study.
Yeah.
It's not that people didn't pay attention to the Vermont study. It's just the people that paid attention were oftentimes folks that were in the system, people like Pat, and they would point to it and say, listen, recovery is possible. I'm recovered. And just like a lot of these people in this study identified as recovered versus in recovery for the rest of their lives. So you're right. And one of the things I wanted to point out, Dr. Harding was asked by Bob Whitaker, who also spoke at the RSVP Conference twice. He was doing the interview of Dr. Harding. Bob Whitaker asked, final question, is our current paradigm of care that emphasizes continual antipsychotics use worsening overall recovery rates for patients diagnosed with schizophrenia and robbing many of a chance at a robust recovery? Interesting question.
Good question.
Dr. Harding says, well, Bob, as I said earlier, all the completely and most significantly improved people in the Chicago and Vermont studies, because again, her study was replicated, were off meds. Isn't there a lesson to be learned here?
Wow.
So,
Mic
this
drop.
mic drop, right? So, and that is how they ended their interview. So,
I like it.
I think there really is significant evidence that all along what we've been promoting here at the board has been true. And what I mean by that is there's a lot of folks that are struggling, maybe given a diagnostic label or two, that can do very well without psychiatric medications for the rest of their lives. And they don't need to think of it in terms of, I've got this diagnosis, therefore this is the only hope I have is to take these one or more drugs for the rest of my life. It's just not true, and it never has been.
I love this as another very hopeful message,
Yes.
I think.
Yes.
Yeah.
I hope that's what the audience gets through all of our podcasts, Dr. Ashley, is we're all about raising hope. But we do that through awareness and education. And some of these things we dip into the past because that's important to me. I don't want people thinking that we just started coming up with this in the last couple of years, that the board just pulled this. No, we've based this on research that's 50 or 60 years old. We've always known a lot of these things. It's just, like I said, hasn't given the kind of platform I think maybe that it should be given. And now I am more hopeful, Dr. Ashley, that these kinds of alternatives are getting more air. And maybe that's because of the rise of more new media, alternative media. You and I are doing a podcast, which we didn't even think of 4 or 5 years ago as something that boards would do. But now we're able to get information out to the community fairly quickly. And so we're excited.
Yeah, it's awesome.
Yeah. Third article. We always like to, if there's a new book on the horizon, I always like to draw attention to it. And again, these are typically books that we think make the points that we try to make on the Keeping Ashland Healthy podcast, and the board supports. And the book I wanted to draw everyone's attention was called Drop the Disorder and Do Something: Activism to Change the Culture of Mental Health. And the author here is Joe Watson, who's a psychotherapist, supervisor, trainer, and activist. And it's actually kind of a follow-up to another book that she wrote, which was called Drop the Disorder, back in 2019. What's interesting about this book, she's collected 40 contributors to this book. And I'll read from what the description, official description says. 40 contributors who are challenging the culture of psychiatric diagnoses and disorder. They include all kinds of high-profile names, including our very own RSVP speakers, Bob Whitaker and Dr. Joanna Moncrief, among others. So again, all these different folks are talking about how they are trying to do something to change the system, just like you and I are doing, Dr. Ashley. And they break up the book into these 4 categories. Part 1 is around rewriting the narrative. Transforming practice would be part 2. Part 3 is art as activism. And some of our listeners may know that last year's RSVP conference, Dr. Ashley, was on art and music and how we can use that more in helping people in their recovery.
Yeah.
I'll never forget that picture you drew. It was horrible, but I really appreciated your efforts.
It's not about the outcome; it's about the process.
Sorry. And then part 4 was activist journey. So very practical. So our listeners who are interested, like us, in different ways folks are going about changing the system, I think they can get inspiration, ideas, encouragement, and support from one or more of these 40 stories. You think about that. So these are all folks that are doing something to change the system. And I guess I find that encouraging, Dr. Ashley, because you and I are, and the board and the work we're doing in Ashland County, we're not alone. It sometimes feels that way. But there are a lot of folks throughout the United States and the world that are really trying to change the paradigm and be more focused on recovery, trauma, medication optimization, and it's very hopeful.
I think so too. I can't wait to read that, actually. I hadn't heard of that before.
I don't know if it's out in the States. I know
Okay.
some of the things get released in England before they get
First, yeah.
But yes, I think it should be here soon. Again, the author is Joe Watson. The name of the book, Drop the Disorder and Do Something, Activism to Change Culture of Mental Health. Change the culture of mental health. And again, all these things will be hyperlinked in our episode description. Now, this last one, you were going to take the lead on because we wanted to feature our last speaker at RSVP this year that we haven't had a chance to highlight.
Yeah, so we want to talk a little bit about Stanley Frankart.
Stanley.
He is a certified peer recovery support specialist, CPRSS.
We always have an acronym,
Yes,
Dr.
always
Ashley.
acronyms. And he's going to be presenting on peer support.
Okay.
His presentation is titled Peer Support, an Evidence-Based Look into the Importance of Peer Support.
Yeah.
So I think Stanley has a really unique perspective. I'm going to share a little...
Yeah, his story. Can you share a little?
A little bit about his bio here. So at 16, Stanley found himself facing a life sentence in prison. According to Stan, he believes that by God's mercy and God's grace, what started as a life sentence ended up being a 10-year sentence where Stanley was given a new life. Stanley is now a husband and father. He founded a peer-run nonprofit organization called Young Christian Professionals, serving those who find themselves on similar journeys of re-entry through safe, stable, supportive, peer-led, and faith-based support in their re-entry. And then, he's done a ton of stuff, so I could list all of that. But I think his story is a little bit different, and it seems like he focuses on helping people who've been in prison re-enter the community, right?
And one of the things that he came to our attention because folks here in Ashland County that are working as peers were trained by him. So he's been contracted with by the Department of Mental Health and Addiction Services to train people that want to be a peer supporter.
Yeah, I think that's great. So in the planning of the RSVP conference, I think it's kind of unique that we have people who are peer supporters in the community and consumers of services involved in the planning process of the conference.
Yeah, that's critical.
And we talked about peer support with them, how important it is, and they really emphasize wanting to have this as a topic at the conference this year. Yep. So that came from them.
Yeah, it did, and I'll just say again, we'll mention this in the episode description, but the state of Ohio is focused on standing up, developing, increasing the number of peer supporters in the state. And because it's still a very young and new discipline, the credentialing process, the licensing process, the education process, the certification, all these different ideas on how to stand it up, how to supervise it. How do you go about setting billing codes? What the job descriptions, if you will. What was the licensure certification allow these professionals to do? How do we incorporate them into the existing community behavioral health system or other systems that they might interact with? All of that is still in process. Stanley, I think, is going to be able to share a little bit about what that looks like in Ohio, but it is part, in terms of what I see, Dr. Ashley, it's going to be with us here in Ohio for a while. Yeah. We've got workforce challenges in the state of Ohio when it comes to behavioral health, mental health, and substance use workers. I think the peer support workers, again, these are individuals that have had life experiences with mental health and or substance use. They're in recovery or recovered, and they really want to give back, and they want to basically utilize that personal experience in helping others in an appropriate way. And they learn that through, again, the certification, licensure process, through training from people like Stanley, who I think leverages a lot of his own experiences in the work he does.
I think that makes sense, too. If you're talking to someone who's been through a situation you've been through, it can actually be helpful in a different way, like a deeper level of understanding of that. And I think that's why peer support is especially helpful for a lot of people.
No, I think that's well said. So again, Stanley is one of several, we think, just wonderful speakers that are coming this year at RSVP. Again, if you haven't signed up yet, you probably can't get in person, but you can still probably get in to see the Zoom because that's unlimited, Dr. Ashley. And we only had about 100 seats in person, and I think most of those have sold out. But if you are still interested, there's probably still time. I don't know. By the time you hear this, time this drops, Dr. Ashley, it might be too late.
Cutting it close.
It'll be cutting it close.
But you can try.
you can try.
Yeah.
And again, it'll be www.ashlandmhrb.org if you would like to register for the conference. And like I said, because we are offering Zoom, you could probably do that. We're allowing people to sign up even day before.
Yeah,
so,
and it's only $10 for the Zoom.
$10.
That's a steal.
You can barely get a cup of soup for that. So, things are going up, prices. But
That's
eggs are dropping, I think.
Oh, good.
I'm hoping, because I like my eggs. Well, Dr. Ashley, I appreciate your input and your reflections as always. For our audience, please, we hope to see you out and about. Dr. Ashley and I will be at RSVP. We will sign things.
Yeah, we'll see you at RSVP for sure.
If you're there, hit us up. We will sign. If you bring merch, we're going to have merch at the conference. If you want a Dr. Ashley and the Boss, Keeping Ashland Healthy mug, we might have a few there. Brooke Seam, our keynote speaker, will definitely have her books there. If you don't already have that, there'll be an opportunity for you to purchase Brooke's book. We're just so thrilled about the conference. We just love the partnership with AU at Convo. We will be recording the conference as well, so we'll give details later on about how folks might be able to access that if they weren't able to make it either in person or Zoom. So, Dr. Ashley, any final words before we leave the audience?
Thanks for listening, and we hope to see you next week at the conference.
Yes, thank you very much.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.